In Myanmar community, it's very unusual for a doctor to sit down, face to face with the patient and explain everything and ask for permission. So, when we do a small consent form, we are really disseminating this little idea of autonomy, little idea of justice. I left Burma in 1988 when I was in medical school. It was unplanned. There was a big political uprising that almost toppled down the military government, but we didn't make it all the way. It was really a life-changing experience for me in that 1.5 years on the Thai-Burma border. Working along the border on a mobile clinic, we see young soldiers who will put on civilian clothing and cross a river to come to us to get malaria pills. We can tell from their, crew cut, the hairstyle and the way they dress and fear in their eyes. And we realize is that you can hate whoever that you're seeing, but you still treat the same way as you do with anybody else. I am trained as a hardcore scientist, but clinical research becomes so interesting to me. It's not because of the science alone, but the application of that science into the human perspective, human, justice and ethics. In Burma now we have 2 parallel tracks ongoing. One is really pure research in the field, working with midwives and pregnant women and doing malaria research. The other pathway is to apply the philosophy of research ethics into a different levels of medical education. Also in the clinical care, starting from very low level of health workers and midwives all the way to the hospital administrator to the minister of health. So, when we do a research project, we have to get a consent from the community. We will tell them exactly what we'll be doing. So there's an immediate connection between the researchers, us, and the community. We have to be transparent. We have to be very respectful. We have to tell them how important it is for us to have autonomy, to understand autonomy, and for them to show their autonomy. Political transition must come from within. It must come from every single level of the society. It cannot just come from the leadership. It's not going to last. I believe that the small changes must take place to get to one large goal.